This is Surya Sahan. Welcome to the Insurtech Story Podcast, the platform to spread knowledge on insurance innovation, digital disruptions, and entrepreneurship. Our website, insurtechstory.com, and we are available on Spotify, Apple, Audible, and Amazon Music. Today, we will discuss on the topic Health Matters, the new age employee healthcare landscape. And I'm sure it's going to be an interesting one, especially in a landscape like India. And for now, I'm delighted to welcome our guest, Kulin Shah, who is the co-founder and COO at Insurtech. With over 15 years of experience as an entrepreneur, he built a B2C startup and is actively involved in the startup ecosystem as an angel investor, mentor, and advisor. Kulin is adept to achieving profit and loss goals, launching new categories and products, negotiating complex deals, and driving user acquisitions and growth. He has successfully built as well as led high-performing teams to achieve ambitious business goals and significant market share. His specialties include category management, business P&L, CXO level engagements, product management, strategic partnership, and fundraising. With that, Kulin, a warm welcome to the show.
Hey, thanks, Surya. Thanks for having me. Really excited about our conversation today.
So, Kulin, we're going to discuss about, of course, health matters and something which is very, I won't say new, but of course not quite widely spoken about, which is on, the employee side of it and where insurance is really playing a key role and what employees, of course, should be made aware of with respect to their rights to knowledge, right? So with that, my first question to you is, in today's fast-paced work environment, what are some innovative approaches that companies are adopting to enhance employee healthcare and wellness? What's your take on this?
Yeah. So, Surya, I think till now, what organizations have been giving, right, and that to only large organizations, and it has been limited to large organizations, has been a part of the healthcare ecosystem, that is health insurance, right? But I think in the last 4 to 5 years, we all have understood that healthcare is just not a financial product, but it's a holistic, well-being and, preventive healthcare also should be included, right? And, when we started off on Surety, right, we realized that healthcare was almost like a privileged product for, large organizations. And we wanted to democratize healthcare. And that's how we kind of, thought about creating a completely grounds up product for not only large organizations, but primarily focused towards small, medium, and medium-sized enterprises. And that's how we realized that a very different approach was required, and a very innovative approach would be required to ensure that people start adopting healthcare and well-being along with health insurance. To tell you a little bit more in terms of numbers, we have 63 million SMEs in India. They hire close to about 330 million people, both in full-time and contractual workforce. And you won't believe it, Surya, that only 5% of them have access to any kind of employee health benefits program. And this is a starking number for a segment of business which contributes to 30% of our GDP. And, we were kind of scratching our heads in terms of, what is it that will be required for these kind of businesses also to come on the same level playing field like their larger counterparts and offer the right employee healthcare and wellness products. What we've seen is that, different size of companies have a different kind of an approach. And, companies in the different life cycles have different kind of products that they provide. So, for example, small and micro organizations, that is anywhere between 3 employees to about 50 employees, right? They genuinely want to kind of offer employee health benefits for the simple reason that they need to attract good talent. They need to retain their talent, right? And while they can obviously match the salary expectations, but benefits that larger organizations that can give, they are not able to kind of get access to those. And that's where we thought that Insurtech can play a very big role out here, and hence an innovative approach needs to be taken. So what we've seen is that there are 3 problem statements that small and medium organizations want to solve for. One is capital efficiency, second is operational efficiency, and third one is employee experience, right? Across all these three, right, they want a solution that is adapt for them. And what we've seen is that any company which can, enroll into a program which is not a long term commitment but a sustainable one, and does not charge a very high amount of fees or premium, right? Those are kind of solutions that they're looking at. uh, Working capital is very very important for an SME, and they basically want a product that is working capital friendly. Second is that they want a product which is not taking away too much of time, not in terms of creating hurdles when they're trying to give this kind of benefits to their employees. And the third one is, of course, that when they take up a product, they are looking for a return on investment. They want to make sure that what they're paying for, they're getting a value against it, which is obviously the entire utilization journey, right from healthcare and wellness benefits to insurance healthcare claims. And that's where we think that a lot of innovation needs to go in, and that's where, at least as an organization, this is where we kind of focus on when it comes to an innovative approach. For example, our product basically helps all the SMEs to provide a small sachet kind of a product which is on a monthly subscription basis, which not only includes just one service but a whole holistic employee healthcare benefits suite of products, which includes right from teleconsultations to discounted health checkups, discounted medicines, health insurance, personal accident insurance, life insurance, access to wellness products like mental wellness, dental, so on and so forth. Second one is obviously the entire part where large organizations can afford to have two or three people, running their employee healthcare program, but a small outfit, right, has only so many people in the organization, but they want to offer these benefits, right? And that's where we make it operationally extremely efficient in two ways. One is from the purchase perspective, where anyone could actually go to an onsurety.com and just purchase the product like an OTT plan, and just use our digital dashboards to onboard their employees. And if an employee leaves, they can delete the employee from their program. All of this is completely automated, empowering an SME to kind of take the entire ownership in their hands, do it yourself kind of a solution, and completely independent of any manual intervention, right? And obviously the most important part is the utilization part of these benefits. So we have a what they're looking for is that the employees don't need to reach out to the employer all the time. They want to ensure that the employees themselves, at the click of a button, can get these benefits and they can utilize these benefits. And hence what they're trying to do is that they want a complete independent autonomous solution which the employees can take and use it. And that's where we feel that in a digital native or a mobile native economy like ours, a mobile app basically helps them right from utilizing all these healthcare wellness benefits, and not only benefits but also the claims, right, which has been typically a paper driven experience. We've completely created a digital experience around it, and these employees can actually now, without the intervention or without being dependent on the company, are able to get these benefits in real time without depending on anyone, and getting the right service. And for this, Onsurety has not only created a mobile app but also created a specialized team internally, which helps at the time of moment of truth, which is the claims in the health insurance part of its business.
So, Kulin, do you see any changes happening within the SME sector with respect to how these products is really, accessed or accepted, or even, how they are much aware of?
So very interesting question, Surya, right? When we started off, right, we did a small research and we realized that, SMEs, and especially, when we think about an SME, right, we're not thinking about just a mom and pop store, right? What we're thinking about is, or what we should be visualizing is that it could be a 15-member marketing agency. It could be a 25 to 30 member small manufacturing unit, right? It could be 100 odd people ITS company, right, having the best of the talent to uh, give services to a global clientele, right? There is awareness, there is a requirement, right? But what these SMEs are looking at is a completely digital experience. What they want is that whenever they provide these products, right, they want a high level of engagement for their employees. They want to use these programs to create employee engagement, right? So from that perspective, I think yes, SMEs are kind of now looking at a more holistic picture when it comes to healthcare and wellness. And given that our segment of the workforce is a very young workforce, and there's a high amount of awareness amongst them, and especially now post up COVID era, right? Everyone is thinking about building immunity, taking prevention, right? In that kind of a scenario, we are looking at a heightened level of awareness for health and wellness, and they are basically trying to create a 360-degree approach towards health today.
Right. No, this is quite interesting. How the landscape is actually changing and how people, the SME side of it, they're, trying to understand better for the broader benefit. Because earlier, if I look at 5 to 10 years, hardly people were aware of, or if even they were, the interest wasn't that, strong as it is building up today. And of course, technology is leveraging it. Right. So, of course, it's a great step in a very niche profile.
In fact, sorry to cut
Please
you
go
here,
ahead.
Surya,
Yeah.
but today healthcare benefits, right? If you look at the Maslow's hierarchy, right, it is almost at the bottommost layer, right, which is a basic must, right? Like in India, we say roti, kapda, and makan, right? When it comes to now being a professional, it is roti, kapda, makan, and healthcare, right? I think that is where we are moving towards.
Yeah.
And if you see, that's the reason why the healthcare industry, the overall wellness industry, and even from an insurance perspective, right, the health insurance industry are all seeing upwards of about 20 to 25% CAGR growth, right, on a year-on-year basis, right? And with the entire population having a higher disposable income, people want to invest behind their health. People want to kind of live a better life. So yes, absolutely, like you mentioned, 5 to 10 years back, this might not have been a part of someone's overall thought process, but being a dominant global economy now, we see similar behavior that we see in our Western counterparts also being almost kind of being replicated out here, where people are looking at health and wellness as a very big agenda in their lives.
Yeah. Yeah. Absolutely. Absolutely. And I think, of course, when you combine the health and wellness products and with insurance, I think it's going to be a game changer. If applied well, and of course, if the ecosystem absorbs it well, and which it will, of course. There's no doubt about it. With that, Colleen, my second question to it is, what new products, technologies, and initiatives are you introducing to enhance employee well-being and healthcare accessibilities for SMEs? And this question is very much important because anyone or a team like yours who are trying to do something big to really disrupt this segment, people must be aware of what are the areas that you're focusing on and what would actually align with their needs.
Very interesting. And let me take this in a phased wise manner, right? Let's say create you know 4 blocks out here, right? Let first block be the product block, the second one be the distribution block, the third one being the entire operational efficiency block, and the fourth one being the claims or the health insurance claims block, right? So let's pick up the first block on the product part of it. I think from an innovation perspective, like I mentioned, uh, we try to kind of create a product which is very, very customized to the SMEs, right? Some of the SMEs which have a very tight budget are not looking for an all frill kind of a product, and hence they want basic health and wellness, right, along with a basic health insurance cover, right? I think we have been you know fairly successful, if I may say so, in kind of combining all of these three products into a single monthly subscription, which means that from an from a perspective of an SME, they are able to pay for these products on a monthly basis, which relaxes the burden on their working capital, right? From a product perspective, they get the basics of healthcare, wellness, and insurance, which takes care of any kind of an unforeseen health eventuality, right, which could possibly burden their balance sheet. Because in small organizations, the expectation of an employee is that if something happens to me, my employer will come to the rescue, right? And the employer does so, but at the cost of creating a burden on their own balance sheets, right? And I think this is something that we've been able to kind of create as a as a very important innovation for the SMEs, because a monthly subscription now allows a lesser friction to adopt a employee healthcare program, which they were earlier not able to take up because they had to pay annual payments, or a lump sum payment, which would really take a toll on their working capital. The second one, I would say, is on the entire, healthcare, wellness, and the insurance combined together, right? We are able to kind of create products which uh, include right from basic necessities to companies who want a full-fledged, holistic kind of a product today, right? So there, we've been able to create close to about 7,500 SKUs at our end, right? And hence we feel that we have a product that meets the requirement of any SME across any industry, right? Create and giving them an ability to create a sustainable program, which is just not a one-time program, right? But giving them the ability to create and these benefits and take them a long term and look at a long term perspective out here, right? Now, think about it this way, that when you want to create, these programs for SMEs, right? These SMEs are looking at, tight budgets, right? So what we kind of did at our end is we said there should be accessibility and affordability, right? From an affordability, obviously, I already spoke about the monthly, subscription part of it. From an accessibility perspective, the way we've created is that we've also launched a complete flexible slash a wallet kind of a product, right? Which an SME can say that I will provide you a base cover or a base membership, right? But at the same time, the employees can further and better their product experience or the product that they want to purchase by taking up the benefits that are more personalized to them and more customized for them. For example, I might, as an SME, provide a basic health package, but I would give the accessibility through Onsurity by saying if you pay, say, an extra 500 rupees, you could include your parents. If you pay another extra 5,000 rupees, right, you can include OPD benefits, right? If you want to include another 1,000 rupees, right, you could actually take a product for your spouse and children, so on and so forth, right? So we've created multiple such products which are now accessible to an employee, which were earlier not accessible, right? And all of this is because an SME has enrolled into a basic plan with Onsurity. Now, the third part about the entire utilization experience, uh, what we realize is that one of the key reasons why a lot of people stay away from healthcare benefits, especially health insurance, is because they are not sure whether the claims experience will be good, right? And will they have to do a lot of manual intervention from their side and a lot of hand holding as an employer to get those claims, and hence what we created at our end was a completely digital claims journey, right? And this is basically something that Onsurity is really known for in its ecosystem, because we've done away with any kind of paperwork, right? Unfortunately, today there are many programs where people still need to kind of download paper forms, fill up those paper forms, attach hard copies, snail mail them to their partners, and then their claims get reimbursed over a period of 30 to 60 days. It sometimes takes even 90 days, right? Onsurity, with its ecosystem of insurance partners, right, has been able to create a seamless journey, and hence no employer now needs to kind of intervene. In fact, to the extent that even small things like having a cancelled check, which is like a compulsory document, right? We're doing away with that kind of a paper, then we're creating a truly paperless experience by doing away with these kind of documents also with our claim stack, right? Where we are enabling our insurance partners to take lesser amount of time to adjudicate and pass or complete the claims process. So we are building an extremely tech driven middle layer, right? And we've in fact enhanced this by using AI and ML, right? Which kind of looks at the claims, understands the claims, and creates a very nice advisory note for our insurance partners, right? Which kind of enhances their ability to pass the claim faster. So we're building a lot of, we're spending a lot of time on these kind of initiatives when it comes to our SME partners. And last but not the least, from a user perspective, we realize that an SME might only be able to provide so many benefits, right? But the user should be able to extract the maximum value out of a healthcare product, and hence our mobile app really helps the employee out here by booking for their entire family a health checkup, using our teleconsultations to reach out to doctors from any part of the country. You can reach out to the best of the doctors, and across multiple specialities, right? To kind of speak to them, either take a second opinion or reach out to them at any given point of time to understand and get a diagnosis of their circumstance or their situation. So yes, we've kind of been investing a lot on our technology, and hence today we are able to work with close to about 6,000 organizations and have close to about 1.2 million users on our platform.
But that's a very important step, because as far as I know, till date, even the large insurers are struggling in converting their paperwork to the digital format, be it your policy document or board rules, and they are really, partnering with various vendors, technology providers to help them do that. And that's not an easy task when you really want to convert. And this step is particularly important because from the beginning you are actually making it everything paperless, and that will enhance the entire efficiency of the process. So I think that's a very amazing step, and of course kudos to the team, Colleen. you know uh, Following that, my last question to you is, what role do mental health program and resources play in the new age employee healthcare landscape, and how can companies effectively integrate this into wellness initiatives? And this is such an important aspect in today's environment because everyone is, due to their personal lifestyle or the kind of work life cycle, are so stressed, and the pattern of work are changing than how it was 5 years ago, right? Even though technology is coming to help things out, but everything is changing, the dynamics, the ecosystem, and mental health is becoming an important factor every day. So where do you see this getting transformed?
Surya, you're bang on, right? Absolutely bang on that mental health is a very important aspect of wellness today, right? Even so much that even the government of India, right, and the IRDA have made it, may have made it compulsory for every insurance partner, right, to kind of include mental wellness also as a part of the health insurance, right? And I think today we are at a juncture where mental wellness is one of the most important aspect of employee well-being. And I could take a little bit of a zoomed out view and then kind of come on to the mental health programs. But with the advent of social media, with the advent of so much of information available, right? There's an information overload for everyone, right? Be it employees, be it children, be it anyone, right? There's just an overload and overwhelming amount of information available, right? And with the growing economy, there is immense amount of competition. There's immense amount of you know um, there's immense amount of need to kind of showcase yourself as a performer, right? And this basically demands a lot of efforts and a lot of time, which can be very overwhelming for anyone, right? And the amount of work and the amount of opportunities that someone has out there to grab, right? Which means that one needs to be really mentally strong, right? When they go and try to grab these opportunities, they try to perform, right? And it is imperative that mental wellness is one of the most important aspect of an employee's life cycle, right? uh, People give so much of importance to physical fitness, but mental fitness is equally important, right? Unfortunately, in many of my own conversations with founders, with business owners, with HRs, right, everyone wants to include mental wellness as an add-on, right? But it's not a part of the company culture, right? And there's a difference between an add-on and a culture, right? The difference is that an add-on product means that if someone has an issue, right, they should go ahead and take a mental wellness session, right? But a culture should basically promote mental wellness, right? And that's where you know fellow employees don't think about mental wellness from a perspective of saying that, oh, that person has a problem, right? Mental wellness is not a problem, and that's the change that we're seeing in many organizations today, because they've made it a part of their culture, saying that we want employees to be strong, we want employees to be mentally fit, and in case they have any kind of issues, right, they have a forum to talk about it. And I think that's where a company like Onsurity can play a very big role, because we work with organizations so closely that we can help them to create a culture around mental wellness and not just an add-on product, right? And these should be integrated right from not just someone calling up a therapist, right? That's a very tactical approach to mental health programs. We are working with organizations where we are actually getting coaches from the outside world, right? Life coaches, career coaches, right? To kind of talk to managers. We're getting coaches to help managers understand how they should, interact with their teams, how they should kind of, interact with their teams across different age groups, how to get, align them with the vision of the company, so on and so forth, right? So I think, like you rightly said, it has to be an integrated approach. It cannot be just a product feature, right? And an integrated approach requires a lot of hand holding for an organization to make it a sustainable one. We've seen so many times that a people function professional or a HR function professional say, "Can you include mental wellness as an add-on?" But there, a lot of employees, think that it's a taboo thing to, talk to a psychiatrist, right? You might be thinking that, what am I talking about? But that is the reality, right? The workforce is fairly diverse today. A lot of people come from small towns into large cities, right? Their upbringing has always told them that, you don't need to see a doctor or a therapist, right? And sorry to say this, but people say, tum pagal hai kya, if you want to go and see a therapist, right? And we need to get out of that kind of a thought process, right? And that is what is required at organizations, at any kind of an organization, be it big, small, large, right? Um, we need to inculcate a culture of mental wellness out there. And we feel that this kind of a approach that goes from right from top down and bottom up, right, that's the time when we'll be able to really integrate mental wellness programs and see a paradigm shift in the productivity of people, a paradigm shift in terms of how people align with an organization's values, and see a paradigm shift in how the organization as a unit, right, really is successful.
Yeah, no, absolutely. As you mentioned, as much as physical health, people take seriously, mental health doesn't get that attention. And as an irony, 50% of the physical health problems will be, taken care of if mental health is in good space, right? In good shape and space.
Yeah. In fact,
So
Surya, just to kind of mention one thing, sorry to interrupt you, but we recently did a study, right, in the technology space, right, where we are talking to technology professionals, right, like software developers, right. Close to about 76% of them, right, have a sleep deprivation problem today,
yes, yes,
right.
absolutely.
Close to about 80% of them have symptoms of depression,
Yeah.
right, because they're trying to create a name for themselves. They're trying to cope up with the work. They're trying to cope up with the learning curve, right? All of this is taking a toll on them, right? And when we did the study, right, we realized that mental wellness plays such an important role. And, you know, every manager needs to be, some sort of a therapist for their team, so that they have an, forum where they can speak to them, they can open up, and they can kind of, discuss their problems without feeling that they're being judged by their own managers. And this requires a lot of work at an organization level.
Absolutely. I think that calls it for, an inclusive culture that promotes mental health as part of every integrated program. I think one of the very important topic we have touched today, and mental, just not to forget, mental health issues are as much as, costly affair as much as physical health is. So taking care of mental health with appropriate insurance coverage is certainly a critical one, and I hope our listeners are certainly will be much benefited with this discussion today with Colleen Shah. With that, Colleen, a fantastic discussion. Thank you for sharing your thoughts today, and a true delight to have you as our guest.
Thank you, Surya. Thank you so much for having me.
And lastly, to wrap this up, you are listening to the Insurtech Story podcast, and see you at our next episode.